Deputy Jones, thank you. On the Conrad Murray case, the defendant is present with his counsel, the people by their counsel. Firefighter Seneff once again is on the stand. All jurors and alternates once again are present. Good morning again. Good morning again, sir. Do you acknowledge, Firefighter Seneff, you are still under oath and still sworn to tell the truth?
Yes, Your Honor.
Thank you. Resumption of direct examination by Ms. Brazil.
Thank you, Your Honor.
Thank you.
Mr. Seneff, when you approached the 100 North Carrollwood residence, did you enter into the gates of the property?
That's correct, through the main gate.
Was the fire truck in front of you when you pulled in?
That's correct. We followed the fire truck.
Did the fire truck remain on the street or come into the residence property?
It remained on the street.
Mr. Seneff, showing you an exhibit previously marked as People's Number 7. This photograph permit you to indicate with your pointer where it is that the rescue ambulance parked when it arrived at Carrollwood?
Yes, the front of the ambulance would have been right here.
May the record reflect the witnesses indicating the area just to the left of the steps in the photograph between the fountain area and the entry?
Thank you.
After Firefighter Blunt parked the rescue ambulance, what was the next thing that you did, sir?
I opened the door, stepped out, went to the side door of the ambulance, and opened that up.
What was your purpose for opening up some back area of the rescue ambulance?
To get my rescue equipment.
What time did you arrive at the Carrollwood residence?
12:26.
Once you retrieved your kit, did you then proceed into the residence?
That is correct.
Was there anyone there at the location directing you or assisting you with information as to where you should go inside the residence?
There were multiple security guards. I followed one of them up to the top of the stairs in the house.
Were you the first in a series of rescue personnel going up the stairs as directed by the security personnel?
That's correct.
And you're carrying your...
I was carrying the starter kit.
The starter kit. And what does the starter kit contain?
It's a plastic box similar to a fishing tackle box, and it has medicines in it.
That would be equipment that you need to assist you in your efforts to assist someone, correct?
That is correct.
Once you get to the top of the stairs, where do you go?
Right into the bedroom.
And what do you see when you enter the bedroom?
I see Dr. Murray, I see the patient, and I see a security guard.
Are you aware of the time at this point that you're at the patient?
Yes.
Do you see, you've indicated that you saw Dr. Murray. Do you see Dr. Murray in the courtroom today? And if so, would you please identify him?
Yes, I do. He's seated right here.
According to the defendant.
Thank you, Your Honor.
Murray.
Thank you, Your Honor. And Dr. Murray that you see in court today, you saw him in the bedroom when you entered. Is that accurate?
That's correct.
Did you also see a patient when you entered the bedroom?
I did.
Describe your observations of the patient, please.
The patient was dressed with pajama bottoms, a pajama top. The top was open. The patient was wearing a surgical cap or something similar covering his hair, and he appeared to be underweight to me.
Then, now, when you enter the bedroom and you make those observations, did you also make observations of Dr. Murray at this point?
I did, yes.
Describe for me, please, your observations of Dr. Murray.
As far as what he was doing at that moment or how he was behaving?
When you entered the bedroom, describe for me what Dr. Murray was doing at that point in time.
At that point, he was leaned over the patient. He was holding the patient's torso, and he was moving the patient from the bed to the floor.
Besides Dr. Murray, who else was in the bedroom?
A security person who was also helping to move the patient to the floor.
Did Dr. Murray identify himself as the patient's doctor when you entered?
Yes, he did.
Now describe Dr. Murray's demeanor, please.
Frantic.
Mr. Seneff, take a look at an exhibit previously marked as People's 21, please. Do you recognize what's depicted in that photograph, and if so, how do you recognize it?
I do recognize it. It is the bedroom.
Does that view accurately depict the way the bedroom looked when you entered into it?
Yes, it does.
And if you could use your laser pointer, please, and show me roughly where Dr. Murray was located when you walked in.
He was standing right in this area right here.
And that would be the far side of the bed near what has previously been identified as the nightstands adjacent to the bed. Is that accurate?
That is correct.
What was the next thing that you did once you made your initial observations of a patient and Dr. Murray? He's identified himself as a physician. What's the next step?
I asked whether there was an advanced health care directive, a DNR.
And did someone respond to you?
Not initially, no.
Maybe put on the lights?
Yes, thank you, Your Honor. So you ask if there's a DNR, do not resuscitate order in place?
Correct.
And at this point in time, is Dr. Murray still in the room?
Yes, he is.
Is the security guard that you saw still in the room?
He's left my line of sight. He walked behind me somewhere.
So it's you and you're conversing or directing your questions to Dr. Murray. Is that accurate?
That's correct.
And when you ask about that information regarding a DNR, does Dr. Murray respond to you?
Not initially, no.
Did Dr. Murray say anything to you when you initially walked in?
Well, no. He was right at that moment. He was moving and I said, "Is there a DNR?" And he just looked at me.
What was the next thing you did?
Then I repeated the question, and he said, "No, there's nothing. No."
What other observations did you make when you're looking at the environment? You see the patient's on the floor, correct?
That's
and
correct.
You see Dr. Murray. What other observations are you making?
There's an IV stand there with the saline bag or something. There's a medical IV type bag hanging there, and I see the underweight patient, and
There was an IV bag hanging on the IV stand. Is that accurate?
That's correct.
And are you undertaking efforts to begin your efforts to assist the victim?
That's correct.
Well, let me use another term. The partial answer is to disregard. We ask. Thank you.
Thank you, Your Honor. Describe for me, please, Mr. Seneff, what efforts you are undertaking at this point in time to assist the patient.
I'm trying to gather as much information as I can to find out what exactly the problem is.
And how are you going about that pursuit of gathering information?
I'm asking the doctor questions.
Such as?
What's his underlying health condition?
What did Dr. Murray respond, if anything?
He responded after I prompted him a few times, and he said there is none.
So when you say you prompted him several times, please describe for us what words you used in your pursuit of obtaining information from Dr. Murray regarding the patient's condition.
I asked what his underlying health condition was. He did not respond. I asked again what his underlying health condition was. He did not respond, and then I think it was the third time, he said nothing, nothing, he has nothing. And simply that did not add up to me.
Why is that?
Doctors in the house, IV pole, IV hooked up to the patient. It didn't seem normal.
Drapes drawn in the residence, in the bedroom where you were in?
Frankly, I don't recall.
So you're assessing the scene, and the information that you're receiving from Dr. Murray isn't making sense to you, correct?
That's correct.
Did you ask Dr. Murray how long the patient had been in this condition or how long the patient had been down?
I did ask him that.
What did Dr. Murray say in response to that question?
It just happened right when I called you.
And in your mind, what did that mean in terms of timing of this patient's present condition?
It meant to me that this was a patient that was somebody we had a really good chance of saving.
Why is that? Does it relate to the timing?
It definitely relates to the timing. It comes down to if he called us right when we got the call, I knew we got there very, very quickly. It means that we're going to be able to have a good chance of restarting the heart, if that's the new.
Your Honor, may I approach the witness stand and retrieve an exhibit?
Certainly.
Mr. Senna, I would like to put people's number 43 back on the overhead projector and ask you some questions pertaining to information contained on that document. May I have the lights, please? Thank you.
You're welcome.
Mr. Senna, you told us that you're calculating the time that you received the call, which you told us the time that you responded out of the station was what time?
12:22.
And does People's Number 43 permit you to describe the time that you are at the patient making the observations that you've just described for us?
Yes, it does.
What time is that?
12:26.
So, basically, 5 minutes has elapsed from the time that you received the call for distress and the time that you are physically with your eyes on the patient. Is that correct?
Yes.
After you enter the room, is the patient's body repositioned into a different area to permit you and the other rescue individuals to provide treatment to him?
That is correct. When we first walked in, the patient had been placed on the floor next to the nightstand, and there's just no room to work there. So one of the firefighters and myself moved the patient over to the foot of the bed.
And showing you People's Number 21 again, does this photograph permit you to show us where the patient located to give you more room?
Yes, we moved the patient to this area here.
May the record reflect the witnesses indicating the area on the carpet at the foot of the bed.
Yes.
Mr. Senna, using your laser pointer, would you show us where the patient's head was and the patient's feet were relative to this location at the foot of the bed?
The feet of the patient would be right here. The head would be over on this area here.
May the record reflect the witnesses indicated that the patient's head would be to the far side of the bed, the feet of the patient would be at the area closest to the entry to the bedroom, still at the foot of the bed, and that would be parallel to the foot of the bed, correct?
Yeah, that's correct.
So at this time, are you still following up with Dr. Murray trying to obtain underlying medical condition information?
Yes, I am.
And you told us that you asked the question approximately 3 times, and Dr. Murray's response was he has none, correct?
That's correct.
Presumably we put on.
Yes, thank you, Your Honor.
Thank you.
What else is going on in terms of efforts to treat the patient at the time that you're peppering Dr. Murray with questions regarding the patient's medical condition?
As I'm asking Dr. Murray the questions, the other members of the team are springing into action, if you will. Firefighter Heron is starting CPR. Paramedic Blunt is starting ventilations and the intubation procedure. Paramedic is hooking up the EKG. Our captain is helping wherever he can.
So it's you Heron, Blunt, and Goodwin all hands-on trying to help the patient, correct?
That's correct.
At this point in time, have you recognized the patient as anyone that you're familiar with?
No, I haven't even looked.
You haven't looked at the patient at all?
No, I've looked at the patient, but I didn't really look at the whole face. I was busy.
At some point, did you learn that the patient that was on the floor that you were treating was, in fact, Michael Jackson?
I did.
Heron is doing CPR. Describe that for me, please. What you observed.
Standard. He's a big, strong man. He leaned over and started doing chest compressions immediately.
One hand or two-handed? And you said that Blunt, your partner who drove the rescue ambulance, was ventilating. Describe what that means, please.
We have an ambu bag, a BVM for bag valve mask, and ventilating the patient. You seal the mask over the face and you squeeze the bag.
What's the purpose of squeezing the bag over the patient's face?
To push air into the patient's lungs.
Did that procedure happen immediately upon the care rendered to Mr. Jackson when you all arrived?
Yes.
Is that critical? Get air into the airways right off the bat?
Yes.
And you told us that your colleague Goodwin was connecting an EKG, correct?
Yes.
Describe what that is and why it's important.
The EKG is the life pack monitor. That's the thing with the picture on it that you see what the heart's doing. It's got 4 leads, cables that attach to the patient via stickers. So he's placing the stickers on the patient so we can find out right off the bat what cardiac rhythm the patient is in.
And you're indicating touching your chest area. Would that represent where the patches are placed on Mr. Jackson's body in order to have the EKG machine properly connected to provide readings to you?
Yes.
And when the EKG machine is connected and taking a reading, what information would be conveyed through that EKG machine?
The EKG machine shows the electrical activity of the heart.
Would that mean whether there's a heartbeat or not?
Yes.
And if there's not a heartbeat, is it a flat line?
Yes.
Did you look at the EKG machine once it was hooked up to Mr. Jackson's chest?
Yes, I did.
What did you see on the screen?
Asystole.
What does that mean?
Flat line.
The machine, the EKG machine, is it a portable machine? You obviously carried it up to the bedroom with you, set it down, hooked it up to Mr. Jackson, and got a reading.
Yes.
So at this point in time, your team has started respiration for Mr. Jackson with the ambu bag apparatus. You've connected him up to an EKG machine in order to determine if there's any heart activity. Are there any medications that are being administered to Mr. Jackson at this point in time?
It's all happening rather simultaneously.
I understand.
Mr. Jackson had a IV in place in his leg. That said, I tested the IV to make sure it would work. And when it did, we gave him some epinephrine right away and some atropine.
And what are those 2 drugs designed to do in the situation where you administered them?
Start the heart.
Once you administered those 2 drugs, were you expecting to see some change in his condition?
Yes.
And did you see any change in his condition?
No.
Are you still following up with Dr. Murray concerning any medications or health condition that might assist you in your life-saving efforts with Mr. Jackson?
Yes.
Did you ask Dr. Murray whether or not the patient was taking any medications or had been given any medications?
Yes, I did.
Did Dr. Murray provide you with an answer?
Yes.
Did he provide you with an answer right off the bat when you first got in and asked that question?
No, I asked a couple of different times.
Specifically regarding medications?
Yes.
And he initially didn't provide you with any information regarding any medications?
What I said initially, of course, was what's his underlying condition, and then when I didn't get what I felt was a satisfactory answer, I explained to him the reason I'm asking is because I see an underweight patient, I see an IV here, and I see medication vials on the nightstand.
In response to your questioning repeatedly regarding medications, did Dr. Murray provide you with information concerning medications?
At that point, he said, no, he's not taking anything, and then he followed that up with, I just gave him a little bit of lorazepam to sleep.
And lorazepam is a mild sedative, correct?
Yes.
Did you follow up with anything else, Dr. Murray? Are you giving him, or did you give him anything else?
Let me think. He did. I asked, was there anything else? Is there anything else? And no, that's it. Just a little bit of lorazepam.
Did Dr. Murray provide you with any information as to what Dr. Murray was treating him for?
Yes, he did.
What did he say?
He was treating him for dehydration and exhaustion.
And that's all?
That's all.
At this point in time, Mr. Jackson has received one round of the starter drugs. He's hooked up to the monitor. And did paramedic Blunt take any other measures to assist with delivery of air to Mr. Jackson?
Yes, he did.
What is that?
He intubated the patient.
What does that mean?
That means he took a tube and placed it directly into the patient's lungs.
And the purpose of placing a tube directly in Mr. Jackson's lungs was to accomplish what?
Overruled. 801. You may answer.
The reason for placing the tube directly into his lungs is it's a clear ventilatory route. It allows the lungs to get a full expanse of oxygen, air, that sort of thing.
Better than the ambu bag?
Yes, much significantly better than just placing the bag over the mouth. When you just place the bag over the mouth, it's common for air to go into the stomach too.
And when air goes into the stomach, it doesn't serve any respiratory effect?
No, and worse than that, the stomach will fill up with air and eventually it'll empty the stomach contents.
You are monitoring Mr. Jackson's progress or lack thereof during your resuscitative efforts, correct?
That's correct.
With respect to the intubation and airway management, are you measuring the success of that life-saving step?
Yes, we're listening to lung sounds, of course, to make sure that air is going into each lung. And then on our machine, we have a capnography device, and that measures whether the ET tube is successfully in place.
Once Mr. Blunt put the ET tube down Mr. Jackson's throat, were you able to have a reading as to the oxygen level of Mr. Jackson through the capnography machine?
That's right. The capnography machine measures the exhausted CO2 from the patient.
And what was the reading that you obtained, if any, once the successful intubation occurred?
Yes, the reading was 16.
Is the intubation process tricky?
Yes, it is.
Did paramedic Blunt perform that intubation in a rapid manner?
Yes, he did.
How rapid?
I was very impressed how quick he got it in the blink of an eye.
Now, at this point in time, you've told us, based on the exhibit of the bedroom depicted in People's 21 that's on the projection screen, Mr. Jackson is laying at the foot of the bed, and where are you situated with the EKG machine and your position? May I have the lights, please, Mr. Seo?
Thank you.
Okay. Again, with the patient right here, the feet right here, the EKG machine is right here, and I'm standing right here.
May the record reflect the witnesses indicating the side of the bed closest to the door and at the foot of the bed. So you are located at Mr. Jackson's feet area, correct?
That's correct.
Where is paramedic Blunt located at this time?
He's at the other end at the head of the patient.
May the record reflect the witnesses indicating the area at the far side of the foot of the bed, between the foot of the bed and the red chair on the left side of the photograph.
Fair enough.
Fair enough, sir.
Thank you.
And there's still activity such that every one of the rescue team is performing a task. For example, is someone performing CPR?
Yes.
Chest compressions?
Yes.
You are focused on the capnography reading and the EKG readings, correct?
Yes.
Paramedic Blunt is at the head of Mr. Jackson, and he is taking care of air and breath management, correct?
Yes.
Now, are you also tasked with communicating with a hospital base station, conveying information from the field to another party?
Yes, I am.
Describe that for me, please.
After we did the initial treatment of the patient, the first round of drugs, we find out what the rhythm is, we find out our basic information, our basic history. I called UCLA Hospital to report to them.
Did you call by radio or cell phone?
I used a cell phone.
Who did you speak to when you reached the UCLA base station?
At the UCLA base station, there's a nurse that's monitoring. I spoke to the nurse there.
And when you spoke to the nurse, what information are you conveying and why?
I'm conveying to him the age of the patient, the condition of the patient, specifically how long the downtime is, what we've seen, what we've done, and all of this because it's going to influence how the patient's treated, treatment-wise, what's next.
When you advise the base station of this information, do they then process that information and give you feedback as to what steps, if any, you should take next?
Yes, they do.
So you are in communication with the radio nurse. Is the radio nurse then in communication with doctors at the base station?
Yes, of course.
Mr. Seneff, when you are tending to Mr. Jackson, you indicated that the time of the call and the patient's side rendering care at 12:26, roughly 5 minutes, did not comport with the patient just having had this episode, correct?
Yes, that's true.
What observations specifically did you make that led you to feel as if there was inconsistent information that you had received with your observations?
Yes, there were multiple observations.
Describe them, please.
When I first moved the patient, his skin was very cool to the touch. When I took a first glance at him, his eyes were open, they were dry, and his pupils were dilated. When I hooked up the EKG machine, it was flatline, asystole, and the capnography reading was low. It was only 16.
Was a set of starter drugs, the drugs to start the heart, administered to Mr. Jackson?
Yes, that's correct. An additional epinephrine and additional atropine.
Was that second round of drugs administered the same way or a different way than the first round?
It was a different way.
Did you locate a vein in the jugular on Mr. Jackson's body in order to administer the second round of starter drugs?
I did the left external jugular.
Prior to
Indicating where on the body, please.
Thank you, Your Honor. Mr. Seneff, would you please indicate what you mean by the left jugular, and may the record reflect the witnesses indicating the left side of his neck area between his shoulder and ear?
Thank you.
Mr. Seneff, prior to you locating the jugular vein in Mr. Jackson's neck area, did one of your team members attempt to locate a vein to administer the starter drugs in another location of Mr. Jackson's body?
Yes, that's correct.
Describe who did that and what they did, please.
Paramedic Mark Goodwin was attempting to get an IV in one of the arms.
Was he successful?
No.
How many attempts did you see approximately paramedic Goodwin make in attempting to locate a vein?
I saw him work on both the right and left arms. I think about 5 attempts.
And he was using a needle, correct?
Yes.
And he was successful or unsuccessful at locating a vein in Mr. Jackson's left or right arm?
He was unsuccessful.
Mr. Seneff, is it more difficult to locate a vein in a body when the person's blood has not been circulating for a period of time?
It's significantly more difficult.
And the lapse of time, 10, 15 minutes, would make a difference in terms of circulation of blood and ability to successfully locate a vein?
I'm not sure about that.
But a period of time where circulation has not occurred is a significant factor in an ability to locate a vein, correct?
I don't know. I honestly don't know if there's a difference between 5 minutes or 15 minutes.
But you just indicated, unless I misunderstood you, that a period of time would have an effect on the ability to successfully locate a vein. Is that accurate?
Yes.
You indicated that you were in contact with UCLA base station and you were apprising them of the treatment that's being rendered and the results of the treatment, correct?
That's correct.
When you were speaking with the base station, did they provide you with feedback regarding what you should do concerning his care?
Yes, they did.
What did they say?
After the initial contact and I explained to them what we had, what we were doing, they asked what we'd like to do, meaning do we want to continue resuscitating the patient or do we just want to stop at that point?
And what was your response?
We wanted to continue.
At this point in time, you have administered how many rounds of starter drugs into Mr. Jackson's body?
When I first made contact with him, we had 1 round on board, and that's when. And then we had 2 rounds on board, and then we discussed it again.
At the point when you administered 1 round of starter drugs and reported back to base station, was there any change in Mr. Jackson's condition from your time of arrival until you update UCLA with his condition?
No change at all.
And then at a later point in the treatment, after the first round, you are conveying his condition again, correct?
That's correct.
Had there been any change in Mr. Jackson's condition at this point?
No change.
So you're speaking with UCLA and you're speaking to a doctor through the nurse, correct?
Yes.
And you're advising the base station that there's been no change, so you have no heart activity, no change in respiration, no other changes in Mr. Jackson's condition, and upon conveying that information, they in turn ask you, what do you want to do, correct?
That's correct.
Was it UCLA's information conveyed to you that they were prepared to cease efforts to resuscitate Mr. Jackson?
Yes, that's correct.
And the reason for cessation of efforts would be that essentially Mr. Jackson was dead. Is that correct?
That's correct.
At some point during your attempts to administer starter drugs, was the IV site that you identified in Mr. Jackson's leg compromised in some way?
Yes, it was.
Describe how that happened, please.
Our starter kit was open, and the medications that we use for cardiac arrest are laying there on top. And Dr. Murray had retrieved medications and was using the IV port in the leg.
And then what happened?
In doing so, he pulled the IV out of the leg.
And at that point, do you then go to the jugular and attempt to locate a vein there so that the mission of administering the starter drugs can be accomplished?
That's correct.
And were there any successful results as a result of the administration of the second round of starter drugs?
No, there was no change in the patient's status.
At some point during the care provided to Mr. Jackson, does someone indicate that they feel a pulse in the body of Mr. Jackson?
Yes.
Was that information conveyed or after UCLA advised that they were prepared to pronounce death?
I'm not sure. It's there because initially UCLA asked what we would like to do. We said we'd go with it. And then they asked again later. It was before. The pulse was checked before the last time they asked us.
Very well. And who was it in the room who identified that they felt a pulse?
Dr. Murray.
And at what part of Mr. Jackson's body did the defendant indicate that he felt a pulse?
The right femoral pulse.
And would you describe for us, please, where the right femoral region of the body is?
That would be in your groin, the right side of your groin, top of your leg.
What did you do in response to Dr. Murray's proclamation that he felt a pulse?
First thing I did was I looked at the heart monitor and see if there was a cardiac rhythm that could create a pulse.
And what, if anything, did you see on that cardiac monitor?
I saw what appeared to be a flat line with CPR going on.
Describe what you mean by that, Mr. Seneff.
The leads that are attached to the patient, the wires that are attached, they get moved in the process of doing CPR, and when they move, they make a mark on the heart monitor.
Is that referred to as PEA or pulseless electrical activity?
No, ma'am. It would be artifact.
I understand. So the movement of generated by the compressions is what caused any movement that you observed on the cardiac machine?
That was my belief.
Did you also take any other measures to confirm whether or not Mr. Jackson actually had a pulse?
Yes,
That, please.
I told my crew to continue ventilations to stop CPR.
And continue ventilations means that the assistance of breath from Mr. Jackson would continue, but the compressions, the up and down motion on Mr. Jackson's chest would cease, correct?
That's correct.
And what was your determination once those requests or orders were followed?
The monitor, the heart monitor, it was a clean, flat line.
And what does that mean to you, Mr. Seneff?
It means the heart was not functioning electrically. And
Basically, that means no heart.
Wait, the witness was saying and?
Oh, I'm sorry.
Okay.
That means it was not functioning electrically, so I didn't feel that there could be a pulse. I then checked for a pulse myself, and also one of the other firefighters checked for a pulse.
What were the results of your checking for a pulse?
I did not feel one at all.
Did you attempt to feel the pulse in the same area of the femoral area that Dr. Murray claimed he felt a pulse?
Yes, I did.
And did you say that another individual of your rescue team also attempted to verify that Mr. Jackson had a pulse?
Yes, that's true.
Who was that?
I believe it was paramedic Blunt.
And did you receive any affirmative or positive information from any other member of your team that they felt a pulse?
No, they did not.
Turning again to the exhibit marked pupils number 43, I'd like to turn to that again for a moment. And Mr. Seo,
Could you
thank you. I'd like to now go over handwriting that is contained on pupils number 43, and you've indicated to us that those are in fact your writing, correct?
Correct.
So What does the 1221 that's in a circle represent?
Yes, that was when the call was called in.
And just to the right of that, can you see where my
Correct.
red dot is? Tell me what that is, please.
That's glucose.
What does that represent?
When I was talking to the base station, they were asking us to find out what the patient's glucose reading was.
And did you provide that information?
Yes, I did.
Did the glucose reading provide any indication that there was any change in Mr. Jackson's condition?
No, it didn't.
And just to the right of glucose, do you see where my pointer is now?
I do.
Describe that information, please.
The EPI is short for epinephrine.
And that is one of the starter drugs that you described for us. That was it Jackson?
That's correct.
And the numbers next to it?
3.5, and frankly, I'm not sure what that was.
Okay.
And 1240, that shows that we gave, what it shows is we gave 3.5 milligrams of epinephrine at 1240.
So it indicates a measurement of the starter drugs as well as the time administered, correct?
Correct.
Now, my pointer is here over these letters. What does that represent, please?
Allergy.
And what is the significance of your writing that information on this document?
When I walk into a call, and specifically this room, I have this piece of paper in my hand. So it's a natural piece of scratch paper. When I asked the doctor if the patient had any allergies, he says, yes, I think Thorazine.
You are recording this information contemporaneously while you are receiving the information, basically.
That's exactly right.
And in response to your query to Conrad Murray, he replied he thinks that Mr. Jackson is allergic to Thorazine.
That's correct.
And to the right of Florazine, there's these letters. Can you tell me what those mean, please?
That's also EPI for epinephrine, and ATR, which was short for atropine, and PIE, and I really don't remember what PIE is for.
Very well. Now I'd like to go over here where this writing is. Can you tell me what that is, please?
That is 1257.
And what does that represent?
That was when I was talking to UCLA, and they were at that point saying that we want to go ahead and call it.
And they indicated they wanted to go ahead and call it because there were no signs of life for Mr. Jackson. Is that accurate?
That is.
There's a box area here to the right. Do you see where my pointer is outlining?
Yes, I do.
Starting with the first line, would you describe for me, please, what that says and what the significance is?
HYD, and that was my shorthand at the moment for hydration.
And that information came from who?
Dr. Murray.
And that information was in relationship to treatment that that Dr. Murray had provided to Mr. Jackson?
That's correct.
The next line?
Lorazepam.
What does that signify, and where did that information come from?
That signifies what Dr. Murray told me the patient had taken lorazepam.
The patient had been given lorazepam by Dr. Murray. Is that correct?
That's correct.
That's the information that Dr. Murray stated to you, correct?
That is correct.
The third line here, would you please tell me what that information conveys?
That says second bicarb. Sodium bicarbonate, it's a medication we give.
And you gave that to Mr. Jackson?
That's correct.
What is the purpose of that medication?
When you're not breathing, your cells produce acid. As the acid levels build up in your bloodstream, it makes it impossible for your heart to function. Sodium bicarbonate is a base, the opposite of an acid. It brings the level back down to a normal level.
Yet another attempt to assist in reviving Mr. Jackson, correct?
That's correct.
Below it there appears to be a number. What is that?
The number's 1400.
What is the significance of that number?
It's when the second bicarbonate was given, but that's not accurate.
What do you mean it's not accurate?
Well, I don't wear a watch. I get my time off of my cardiac monitor, and it was off by an hour.
I understand.
So
But all the other information that you received from your monitor was accurate, correct?
that's absolutely correct.
Base station, you told us that at 12:57 you are in communication with UCLA Base Station and they advise you that because efforts to resuscitate are unsuccessful, they are prepared to call time of death, correct?
That is correct.
Your Honor, at this time I have an exhibit that I ask you mark People's number 44, please. It's a CD.
Mark, People's 44. If I may, Firefighter Seneff, you indicated that the time of 1400 is incorrect by an hour. In which way?
It was actually 1300.
Thank you. It's marked People's 44.
Thank you, Your Honor. I also have a transcript. That is a 2-page document. May it be marked People's number 45, please.
It is?
Your Honor, may